Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop shoulder bursitis pain. But before I go over that, we need to understand what is bursitis, shoulder bursitis, the causes, the risk factors, and the symptoms of shoulder bursitis, so we'll be able to treat the root cause of the problem. And then we'll go over the steps that can be taken to stop bursitis pain. So first, what is bursitis or bursa? So bursa by definition is like a cushion, a fluid cushion, a sag that actually protect the joint from the tissue that around it or above it or below it. And it's actually, you can see it here in the blue. We have a lot of different several bursa here in the shoulder joint. That's actually to protect the bone from rubbing the other tissue, because if you don't have bursa, the bone gonna rubbing on the tendon or ligament or the muscles, and that will cause tear and cause calcification in the bone. So you have those bursa in between. It's kind of cushion to keep things very smooth, not rubbing against each other. So it's a cushion, it's a protective mechanism to protect the bone and the overlying soft tissue. As you can see here, we have several bursa, like the subacromial bursa here. You can see two of them in here. Subdeltoid bursa, it's right here, and I will show it to you here with the model, this model. So basically, I don't have any bursas here, but as you can see, go back here a little bit. So as you can see, there is a space between the bone here, the bone and the ligament and the tendon of the rotator cuff. So that space, you need to have the bursa in between to protect those structures. So the problem with bursitis is actually the bursa is inflamed. Anything ending with itis is inflammation. So when that happens, that space, which really very small space, and you have that inflamed bursa, it gonna restrict the movement of the joint. So when you lift your arm up, that bursa will limit the contraction and the elasticity of the tissue underneath it, and it's in the way. So the symptoms of shoulder bursitis, it's typical to experience like pain, especially with the overhead activities. Lifting your arm up, you can feel some tenderness in the front of your shoulder here, especially if there's the bursa that's inflamed. And when you lay down on the affected side, you might experience pain. Also, some people could experience shoulder stiffness and weaknesses. So what are the causes for bursitis, inflammation in the bursa? The typical cause is repetitive overhead motion, and that could happen from sports activity like baseball, swimming, or tennis players or golfers. In repetitive motion that could cause the bursitis. Also, some occupation that require a lot of heavy lifting, especially overhead lifting, that could cause bursitis. The other thing is if you have injury, a blow to the shoulder or fall or hit, that could inflame the bursa. So some people who experience arthritis or rheumatoid arthritis, gout or thyroid disease or diabetes, that's usually a risk factor for having bursitis in the shoulder area. So how to treat bursitis? So as we said, it's itis, it's inflammation in the bursa, so it's swelling. But reality, it's never bursitis only. It's very common especially with the shoulder, that you have bursitis and tendonitis at the same time. So in order to really treat the root cause of the problem, we need to understand the normal healing cycle and where your body's stuck in that healing cycle to really address it properly. So I'm gonna use external paper cut for visualization, but the same process happen internally in your shoulder. So the first is stage of healing is inflammation. Swelling, redness, as you see in the first image on the top, swelling, redness, the blood starts to rush to that area, and you start to experience pain and decreased function. And that's very classic with the bursitis. It's actually inflammation in the bursa, so the bursa size actually swells up. So the second stage of healing is the proliferation stage. That's when your body starts to build the scar tissue. There's always a cascade of events happen during the proliferation stage, which is fibrosis, which is the scar tissue, fascial restrictions, muscle spasm, trigger points. So I'm gonna focus on the scar tissue here just for the sake of our time. So perfect scenario during the maturation stage, which is the last image here, your body should get rid of the proliferation issues, which is scar tissue, fascial restriction, muscle spasm, and clear up also the inflammation. That could take days, weeks, months, or years. As we get older, the speed of the healing process decrease significantly. And for chronic condition, some patients, they actually going back and forth between inflammation and proliferation here. So think about this way, you had a lot of repetitive injury here, or repetitive overhead activity. It's not only swelling, the bursa is only swelling. The other tissue around it, and it's usually combined with tendonitis, which is inflammation in the tendon of the rotator cuff. They usually comes hands by hands. And when that happens, you have a lot of inflammation plus a lot of scarring because your body tried to recover from the micro tear that caused by the repetitive motion. So I'm gonna show you an image here for normal muscle, what's look like. So the first image here, normal muscle, there is no injury, nice and clean. And then when you start to have micro tear in the second image here, that's when your body starts to build a scar tissue. But the problem is when you look here, when your body builds a scar tissue, it's a very random scarring. And if your body not dissolve those scar tissue are gonna be in the way of everything. The other problem is in the shoulder, you really look here, you really don't have enough room. So basically here you see there's a kind of a very like a few millimeters of space here, and that space occupied by the bursa. So when the bursa swells and you start to have tendonitis or inflammation here or scar tissue, that is gonna limit your range of motion for moving up because it's in the way. It's like my t-shirt here is very tight, so I will not be able to move my arm up. So that's good. That is the main cause of the bursitis pain or limitation of the range of motion as a result of bursitis. So what should we do to treat bursitis? I'm gonna go over what currently exists that doesn't work very well, so you don't have to waste your time on it. And we'll relate everything to the healing cycle, so it will make sense what you should do to really get to the root cause of the problem and not wasting your time in treating the symptoms. So the first thing that a lot of people use is the ice, not the heat, ice to decrease inflammation. But when we look back here to the healing cycle, ice is temporarily gonna decrease the inflammation. It's not gonna do much to the inflammation, and it's not gonna do anything to the proliferation stage. So that's not gonna treat the root cause of the problem. Electrical stimulation it causes a temporary pain relief, and it does not do much to the inflammation and the proliferation stage. The other thing that commonly used is foam roller and massaging those areas. The problem with that is if you have inflammation in the bursa area and in your shoulder and you rub it, that's gonna make it inflame more. The other issue is several studies shows massage and foam roller does not provide long-term result. It's temporary pain relief. And when we look at the healing cycle, and when I go over the anatomy of the fascia system, you will know why the foam roller and the massage are not effective, because they're not gonna go deep enough to really release the internal tightness. The other thing has been used by a lot of healthcare providers, joint mobilization or adjustment or manipulation, which mean it's actually moving the joint. So when we look at the healing cycle, what that gonna do? Actually, if you have inflammation and you rub the joint and keep mobilizing it, that's gonna inflame it more. So it does not really do much to decrease the proliferation stage or help with the inflammation. The other thing that a lot of people do is stretching, and I personally do not recommend for stretching for my patient because there is other safe alternative than stretching. And think about this way: you have inflammation, or you have like a micro tear in the rotator cuff, and that's what causes the inflammation in the bursa and the tissue around it. If you stretch it, that tear could increase. And the problem is, based on the study, stretching is actually cause more inflammation. But if you cause more inflammation, you're gonna cause more scar tissue and will get you in the same vicious cycle. That's why I don't recommend the stretches for my patient. There's other alternative safe option than stretching. Strengthening exercises, we need to introduce it, but during the right stage. If you are in a lot of inflammation, strength exercise is going to inflame it more. The repetitive motion that causes the injury, you want to avoid it initially. We don't want to use those exercises or activity that actually cause the trigger to treat it. We don't want to use that. So what should we do? We actually need to look at the healing cycle and address those two stages, the inflammation and the proliferation. So for the inflammation, if you have a minor case of shoulder bursitis, give it 5 to 7 days. Take it very easy, rest. I will avoid too much of the overhead activities. You just need to move, because if you don't move your shoulder, you might end up with frozen shoulder. So you want to be active, but you want to avoid any overhead activities with lifting that cause the inflammation. Give it 5 days to 7 days, and if everything is solved, that's great. If not, that's a sign you might have moderate to severe inflammation and your body going back and forth between the inflammation and proliferation stage. So if that's the case, what I personally use is the Magna Heal. This is a very strong magnet that actually can be wrapped around the shoulder. The magnetic field is around 3 inches that can penetrate the body. It's very strong magnet to decrease the inflammation. The other thing I like to do is to put my patient on anti-inflammatory diet, because there is a lot of food that actually cause internal inflammation that slow down the healing process. So, and it's a very common, especially if you have bursitis, tendonitis, and other health issue that cause your body going back and forth between inflammation and proliferation. It's common to see a patient has vitamins, mineral, hormonal imbalance, and that slows down the healing process. One of the way you can do actually today, you can take advantage of Ask ASTR. It's a free online medical evaluation that's going to help you to figure out if you have possible vitamins, mineral, hormonal imbalance that might slow down your healing and get you in that vicious cycle of inflammation and proliferation. So the other thing we have to address simultaneously is the proliferation stage. As by definition, bursitis is inflammation in the bursa here, but it's not only inflammation. They usually scarring around this area. They usually get some kind of tendonitis around this area, irritating the rotator cuff tendons. And you start to have muscle spasm. You start to have nod all over the trap area, the rotator cuff, the biceps, that will cause more limitation. So we have to address all of that. So what I personally do is I use the A3 tools, and I'm very conscious, and actually I give instruction about how to use it so you don't cause more inflammation. So I use the A3 to break superficial scar tissue and any superficial adhesion. And I use the A5 to break deep scar tissue, release deep trigger point, and release deep fascia. The other thing we have to work on simultaneously is the fascia system. And I will briefly go over the fascia system here because it's extremely important part of treating shoulder bursitis, and it's overlooked by a lot of people. And I want you to appreciate that system because it's very important to address all the fascia system for the best result. So the fascia system, the superficial layer, is like a wrap surrounding the entire body. It's like a Spider-Man suit wrapping the entire body. You can see it here in this image. The white tissue here, those are the fascia layers. So we have two categories of the fascia: superficial layer and deep layer. The deep layer is actually divided to 4 subcategories of the fascias. The apparatic fascia, which is wrapping a group of muscles. And then we have the epimysin that's wrapping each individual muscle. You can see it here. And then we have the premiysin that's wrapping a group of muscle fiber bundles. And then at the end, we have the endomysin that's wrapping each individual fiber. So I'm going over this to appreciate the complexity of the system, but don't worry, the treatment is very simple. So to make things worse, actually, each of those layers have 2 to 3 sub-layers. So the apparatic fascia has 2 to 3 layers of those apparatic fascia. The epimysin has 2 to 3 layers of the epimysin layer, and so on. And that's why I said the massage and foam roller is not going to be effective, because it's impossible with the knuckle, if you use it for the massage, or your elbow, to go deep enough to release the epimysin, premiysin, and endomysin. And that's why I invented the A5, to really go deep, to really break, to release those adhesion that's deep in. So what I personally use to release the fascia system, I use the A1, and I use the A1 to release the superficial and apparatic fascia, and I use the A5 to release the epimysin, premiysin, and endomysin. As I mentioned to you, you have to really release all these layers, because when you have a scar tissue, when you have adhesion, when you have inflammation, it's usually those layers are stuck together. You're losing a lot of elasticity, and it's those tissue get stuck together. So to summarize the treatment, first, if you are in minor shoulder bursitis, stop the repetitive overhead activity, especially with the lifting. You can move freely without pain, but just to stay active, don't guard it too much so it does not end up with the frozen shoulder. You want to move, but you don't want to do too much movement. The other thing, if after 7 days you still have the same issue and has not been resolved, that's a sign that you are going back and forth between the inflammation stage and the proliferation stage. So what I do for the inflammation stage, I use the MagnaHeal to wrap it around the shoulder to decrease the inflammation, start the anti-inflammatory diet, and if severe inflammation, we usually try to figure out if you have deficiency, vitamins, minerals, or hormonal imbalance. At the same time, working on the scar tissue, the fascia restriction, releasing everything, and then introducing the exercises when inflammation is calm. So this way you gain strength without causing more inflammation. So if you have any question, leave it in the comment section below, and I will answer it in the future video, and I will see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to ASTRinstitute.com.